We've all heard the phrase, it takes a village to raise a child. But the thing that we often forget is that it also takes one to support the mother.
Well, speaking of the village, this is our podcast. I'm Nicole Harlow.
And I'm Dawn Thompson. And we're here to connect you with a village of support you need from pregnancy to parenting.
So come on this journey with us as we build your village one episode at a time.
Hey, good morning. Thank you guys so much for being here. I am here with my amazing co-host, Nicole Harlow. I am Dawn Thompson. And today we're joined by a dear friend, Diana Snyder, who, Diana and I go way back, and I'll just we'll talk about this on another episode, but Diana single-handedly allowed us to file the first assault and battery case in the state of California against an obstetrician. And it was because of her work that we were able to do that. And this wonderful person, Kimberly Turbin, was able to get some justice against her doctor, who very violently abused her, and it was all caught on video. If you're interested to understand or look up the case, you can just look up in the media Kimberly Turbin, and you'll see all about it. But we will talk about that on another day. Diana, thank you so much for coming on the show today.
Thank you for having me. I'm excited to be here.
Cool. Well, why don't you I think your journey to doula work is pretty cool. I guess I was a part of it. I was a witness to it. So maybe kind of back up. Where did we meet? You and I met in LA at a Know Your Rights workshop.
Right. Yes. Like 2013. So over 10 years ago.
That's crazy.
And yep, I was just a little baby lawyer at the time, working in a big fancy law firm in California. And now it's 2024, and I am at my office at a freestanding out-of-hospital birth center where I work as a doula and a birth assistant, and I'm still licensed as a lawyer, but my work is much different now.
I bet. Well, talk to me about how because I'm not even sure I remember how you even got interested in the workshop.
Yeah, so it's a pretty wild story. So actually, a friend of mine from high school that I'm still close with was doing her OB-GYN residency in Los Angeles, actually. And she contacted me out of the blue one day. I had seen her sharing a lot of content on Facebook from Improving Birth. And it was so interesting because, right, you learn so much about women's rights and reproductive rights, and that's focused largely on a few issues, but you never hear about it in the context of what are women's rights in birth and in pregnancy and in maternity care. So that was really putting off a light bulb for me. And then this friend, again, she was doing her OB-GYN residency, and she reached out to me and said, I just see a lot of issues in my workplace with lack of informed consent, with a lot of unnecessary intervention, inductions, C-sections, women not being given all the information, people not being given choices, people their providers not really telling them what the evidence is, just sort of pushing blanket recommendations on them for risk management or just personal physician preference, fear of liability. And she said, I'm having a really hard time with it. I feel like I'm causing harm, and I want to talk to a lawyer about it because I feel like there's so many legal issues here in terms of patient rights and medical ethics. I just wanted to talk to you about it. So that's how I got into this, actually. Wow. And never looked back. I found that fascinating. And she and I are still in touch. We're still in touch.
That's amazing.
Yeah.
Well, then you came to the workshop, yep. But I don't even think we'd connected with Kimberly yet at that point.
No, I don't think so. I think it was, or maybe that was just in its early stages and you had told me about it, perhaps. And then we kind of took it on as our big mantle and project. But yeah, I think I was just very interested in, I had a law degree, and how can I use that to support this cause, which nobody's ever heard of, but is kind of a huge issue.
Yeah. Ultimately, I'm really proud of the fact that the work that we did, all of us together, you, me, Kristen, Rebecca, and so many others, ultimately in the end, that we raised the issue about informed consent and obstetric violence. I mean, our organization was the first, we were the first people to put obstetric violence in print in the United States.
Yeah.
You know, like that became a huge thing. And I'm just so damn proud of it.
It's incredible.
Yeah, I think it was pretty magical. And it's definitely one of the things that will, you know, go in my memoir when I write it one day, right?
Yeah.
So, but let's talk about how you though transitioned into, I mean, you gave up this incredibly, you know, what most people would see as a lucrative law career to become likely an underpaid doula. Like, because God knows doulas do not get paid enough for what they do. And they're I think it's amazing how people are underestimated frequently who are doulas. But Caitlin, remember in our Caitlin Schulemeyer episode that just aired actually this week, she was talking about how she's a doula, a midwife, and a labor and delivery nurse, and that she actually sees her position as a doula as the top, not where most people would assume it's the bottom. But she's like, and here I have a completely different view. I do not see it that way at all. And in fact, I got to see the most as a doula because I was there early. I was there postpartum. You know, like you get a much broader view of what women are going through when you are a doula.
Well, it's interesting too. I am not a doula. Let's just put that out there. But I'm often mistaken for one because of the work that I do. And I will not call myself a doula because I regard that title so high. And I feel like I'm not worthy of it until I'm, you know, boots on the ground at births, which I will be one day. Just not while I have 4 kids under 7.
Fair.
You know, I want to give my all to those women, right? And I just can't right now. So, but yeah, it's interesting how the perception of a doula really is. So I think that would be a great topic to kind of start on too.
Yeah, for sure.
Diana, story.
I led that with a question and then rambled on, but talk to me about that transition of leaving law.
Yeah, it was a hard decision because of course, like I worked extremely hard for my law degree and then my 2 licenses, right? Then you have to take a very intense bar exam. I was licensed in 2 different states, including California, which is the hardest one to pass the bar exam. It's 3 days.
Diana, can we just pause real quick? I need you more in the center of your camera. There you go. Okay, great. You were just, it was drifting more and more and you were like right at the corner. So, because this will be, you know, this goes on YouTube too. So
I didn't know that. Okay. Yeah. I would have done my hair, but can you remind me the question? Sorry.
Yeah, I was just asking you that transition and that decision to make.
Yeah, it was a really hard decision, right? Because of course I worked very, very hard for my law degree and that was what I wanted to do for a very long time through undergrad, you know, and then I passed those 2 bars. I was licensed in 2 different states, including California, which is the most rigorous bar exam to pass. It's 3 days. It was very challenging, right? And I worked really hard at my law firm job, right? Like I thought that was the track that I was on. You know, that's kind of what's put forward, like you said, is a very, very high-powered, prestigious, you know, path to be on. But like, of course, I realized when I was in it, not just because of the work with improving birth, but for a lot of other reasons, it's just wasn't really authentic to who I was. You know, it was a part of my life and I'm proud of it. And I'm glad that I did it, but I realized that, you know, my passions and my skills could be better put to use elsewhere and that I would be happier. And it would be better for my, you know, family life. If I was able to do something that was really more in line with who I am than kind of going to work every day in high heels and pearls and a suit or whatever and helping like, you know, billion-dollar companies make more money with like transactions, right? Like it was just not feeding my soul. And so, you know, I tried to make it work for a while in the sense that, right, when I moved back to Boston, after doing all that work with improving birth on informed consent and birth rights, patient rights, I kind of, when I moved back there, I tried to continue that with just doing midwifery advocacy, policy advocacy around, you know, access to home birth, access to out of hospital birth centers, you know, helping home birth midwives in Massachusetts achieve licensure, because that's, you know, is one of the last holdout states that wasn't licensing CPMs, and there was a lot of issues with access there. You know, and I just worked on that because midwifery is a passion for me as well. But eventually, after I had my first baby, like as the story often goes with doulas, you know, my birth experience changed me, right? It's pretty classic. You know, most people who become doulas either do so because they have an amazing experience and they want to help others have an amazing experience, or because they had a very hard one and they learned a lot and they want to help others avoid some of the pitfalls that they fell into. And so it was the latter for me, right? Like I thought, because I already knew a ton about birth, that I was in the best position to kind of protect myself from falling into some of those classic traps, you know, avoidable C-section. And even myself as a lawyer, I'm pretty assertive, you know, strong self-advocate. Like I still had a really, really, really hard birth experience, was not able to effectively advocate for myself, didn't have the support that I needed. And it like kind of destroyed my confidence. It was a terrible introduction to motherhood for me, and was very hard for me to overcome. Like I remember at the time before my baby was born, I had actually been appointed to the board of MEAC, the Midwifery Education Accreditation Council, that oversees the education for out of hospital midwifery, like credentialing programs. And I was really excited about that. And I had to withdraw from that position because I was experiencing such severe like depression and anxiety postpartum. You know, I wasn't sleeping. Was recovering from a C-section. It was really traumatic for me. And I just got put through the ringer, right? And so it was hard for me to just like go back to that work that I was doing as if nothing happened, because everything changed, as it does for so many people. And I was not immune from that, even being a lawyer who knew a lot because of my prior advocacy, right, that I had done. And so eventually I just felt like it wasn't sustainable for me to go back, or even healthy, like, because I just had my own trauma as well as secondary trauma from some of the work that you and I had done together that was really gnarly, like what you described with Kimberly, like some of the things that people would contact me about wanting legal representation for was like really abusive, like really horrible, like people who had almost died. You know, I had a father who lost his wife in childbirth in New York City, which is a very high profile case all over the media, contact me. And I was just one person, right? Like I was a new mom, also struggling with postpartum depression. You know, I wasn't working at a firm anymore. I didn't have the resources to be doing that. And I knew for my own health and well-being that I had to take a step back, basically. And so I just decided, like, how can I still work on, you know, this issue that I've become so passionate about and make a positive difference, and also have it be more sustainable for me. Not that there's not challenges with dual work and a family as well, but like I just decided, I was like, honestly, I have a lot of unique knowledge, and I've been through a lot and learned a lot. I could probably really help people one-on-one as a doula and like in a patient advocate type role. And so I just jumped in and I did a training, and I built my business, and I didn't look back. And, you know, I often do have people ask me, like, do you regret, like, do you miss the law? And sometimes I do, of course, but like, I think I'm better at this actually than I was at legal work. We can talk about it more, but like I have my own niche now. Like I have a very specific type of client I work with, and I feel like I am really helping people, and ideally helping people catch them on the front end so we prevent trauma, right? Rather than having to catch it on the back end where there's nothing that you can do to change what's happened, and you're trying to play catch up, and you're trying to seek justice for something on the back end that's already happened. And even if you do, which like we discussed earlier, there's like so many barriers to seeking justice on the back end. Even if you manage to do so, which you may not, you know, it's not going to change the trauma of what happened to that person, you know, and it's probably not necessarily going to change the system, if that makes sense. There's so many barriers. And so to me, I have really preferred, you know, being able to work at change from the inside, go family by family, and help people that way. And it's been so rewarding. And I've had so much growth that I don't think I would have ever had. It's trying to be an advocate from the outside that wasn't on the ground attending births, right? Like there's so many independent advocates out there who are not actually birth workers who are doing incredible work. But, you know, one of the things I've realized, of course, since now I'm on the inside of it and I've been, been to hundreds of births now, is like, it's really hard to really, I don't want to say know what you're talking about, but unless you've been at births and you have been in that, birth space and labor and delivery room, interacting with obstetricians, interacting with labor and delivery nurses, supporting a client in this most vulnerable time and trying to navigate those dynamics, it can sometimes be hard to really propose adequate solutions for change if you actually have not done that.
Yeah.
If that makes sense. Yeah.
No, totally. I mean, I think about, ultimately I've started Birthify for exactly this reason is I feel like sometimes I'm desperate to reach first time parents, right? Going back to your comment about, that like, because too often as a doula, the person who's hiring me is the second time mom.
Yeah.
And it's because they had such a horrific experience the first time and had the realization that they didn't know enough. They did not prepare enough. And I remember even, for my own first birth, I mean, it's why, like you were saying, Diana, of turning to try and help other people because you had a negative experience. It's like, even my own birth, I went to the childbirth education class. I read what to expect when you're expecting. I just thought you just show up and a baby comes out. You know what I mean? And like, I literally, while they were cutting me open, I said to my ex-husband, well, that class was a total waste of time. I said those words and not realizing. And of course, it wasn't until I took my doula training that I can look back and just see how I fell into the system. I just fell into the system and it kept rolling and rolling me over with it. It's like, I just I'm visualizing, big tractor tires,
Yeah.
and I'm running. And then suddenly I'm not running and I'm just rolling around on that tire. That's how it feels sometimes.
Yeah.
And I mean, and it's unfortunate that people are just sometimes lucky when they don't get caught up in it.
Yeah.
Or they have just a smooth, straightforward, birth.
And that's all our system can really tolerate, right? Like, it's like only the easy, smooth ones that like thread the needle perfectly are what come out of our system with like a uncomplicated vaginal birth. And, it's wild. That's probably like 15% of births, right? That what about somebody else, right?
Right. So what do you feel like? So I know initially when you started out, you were combining your legal resources and your doula. Are you still doing that as a legal doula?
Not really. And so here's what I found. Here's part of why I moved away from that. That if somebody is coming to me as a doula and they're feeling like they need me in the birth space because I'm a lawyer and they want legal advocacy in the birth space, that is a problem. That is a problem. They should not be with that provider if that's how they feel. And so really, part of why I'm not doing that anymore is also because that's not like in the birth space. I have, but like, it's not a good situation for me to be operating as a lawyer in the birth space, for me to be flashing around my lawyer card. That can create more problems than it solves. I have learned over time. I mean, certainly I will support a client birthing in any setting with any provider that they think is best for them. But I am very big on, if somebody tells me what their goals are and they're with a provider or at a facility that does not practice that way, I will let them know that, and I will let them know other options that are better aligned with what I hear them telling me, right? And I will encourage them to explore their options and consider switching care, right? Like, of course, that's not my decision. That's very personal. And if somebody decides, and I have had some of my most favorite clients actually including VBAC clients, are some who have chosen to remain in a setting that was really restrictive and was not in line with what their goals were. And I will, of course, always be there for a client, no matter what their choices are. It's not my decision, but I am really big on being very, very careful who you select as your provider, and that the biggest predictor of your outcome, the biggest way, not guaranteed, but one of the biggest protectors against trauma and, avoidable C-sections is, careful, intentional choice of provider. The best situation is one where I don't need to be telling providers that I'm a lawyer. That's not helpful. I really find that I advocate most effectively when I'm able to gain trust of the provider team, right? I'm not there to, of course, they're not my client. I'm not there to necessarily make them happy. That doesn't mean that I kind of just am there to make them feel good. Like I'm there for my client, but also it's best if I can have a conversation with them and they can tell that I know what I'm talking about and I've been around the block a few times, and that my proposals to them about, or my questions to them are reasonable, and they feel like ideally we're working together and we're on the same team. And even if not, they can respect where I'm coming from, and we can have a frank conversation where we understand each other, and they get that, like, I'm not trying to cause a problem for them. Like we're all trying to work together to have a good outcome here, and that I have been to enough births that, like, I know the questions to ask, if that makes sense. So to me, that has been a way more effective form of advocacy. And I love to do that. I'm very proud of it, and I just love what I really do.
Yeah.
So Diana, you mentioned that you work in a very specific niche right now, right? Yes. And I also know that you and Dawn are both VBAC moms. So maybe we can talk about that. And, some of the listeners may not even know what a VBAC is. So we wanted to start with just basic for those, and then kind of get into why you would want one and how to effectively, make it happen. And I can not speak it from experience. I have had all vaginal births, but my sister actually earlier this year was a successful VBAC.
Oh, congrats. I heard you say that before.
Yeah. Awesome. The only other thing I wanted to say to this last thing that you were talking about, though, before we move on to that, is that, this is what you're talking about is exactly why I left the bedside, because I could not any longer not be the advocate. I had become an advocate and not a doula. And I see that those are two different things. And and you have to kind of separate the two in certain situations. Obviously you can still advocate, but I had become such a passionate advocate that every little thing pissed me off. Like I would be in the labor and delivery room, and I realized that I was being adversarial, and I was actually creating more of a problem. And finally and each time I'd go to a birth, I would try really hard not to be. And I realized I wasn't capable of it.
You also, it's so hard though, because in part, we could talk about this forever, right? Is like that regional variation in how maternity care is. You practiced as a doula in an area that I think is much more difficult than where I practice now. I'm very spoiled in the sense that we do have a lot of wonderful options here, including a lot of great hospital providers for VBAC and for other things, right? Like, Southern California is, I think, a much more difficult environment. And I think that any doula could really face burnout in that area from what I understand.
Yeah, it was pretty intense. But I mean, I did all the same things that you're talking about. At first I didn't, but eventually I started talking about like, okay, well, if this is the birth that you want, that is not the hospital and doctor for you.
Yeah.
Right. Like I hear what you're saying. I'm just telling you that I'm not sure that that's where you want to be. Or there was nothing more powerful when people called though, and they were asking about my services, and I said, the first question I asked is, who's your doctor and what hospital you're with?
Yeah, 100%.
And if they said, I'm at Sharp Mary Birch, I would immediately say, I'm so sorry, but I choose not to take clients at that hospital. And you know what the next question is? Why?
Yeah.
And then I said, well, listen, I'm happy to tell you why, but you need to, like, I'm trying to give a caveat of like, I'm not trying to talk you out of it. And inevitably, almost all of them changed providers, changed hospitals, and hired me.
Yeah.
But anyways, let's go on to the feedback
people
part.
are glad to hear the honesty, right? Because people don't know what they don't know.
Yeah.
And there's no way, especially for first-time parents, to understand necessarily how they're provided. Like, especially, I feel like we could talk all day out there in these moms groups, right? People are like, oh, my doctor is amazing, go with this doctor. And that's how people are picking their doctors. And maybe that person has a 45% C-section rate and they never see unmedicated birth, and they induce every single person at 39 weeks. And, if somebody is wanting a low intervention birth, and that doctor's saying, sure, we'll see, we can, yep, I'm comfortable with that, we can do that. How are they going to know what else is out there, right? It's really hard. And we can talk about that all day, I'm sure.
Yeah. Well, I mean, I think it's, what bothers me a lot about advocacy work is that it feels like a lot of people look at you as like you're some extremist, right? And like, that just bothers me so much. Because
no, I feel like with the hospital providers too, they are siloed in their own institution. They often do not know. And that's the cool thing about being a doula, is you go to all the facilities. You know how this practice differs from that practice. You know what policies at this hospital differ from that hospital. You know which hospitals will, do VBAC after 2 cesareans and which hospitals barely do VBAC at all. All the little differences because you go to all of them, and you can say like, hey, before we do a C-section for 4 hours of pushing with a posterior baby, like, what about an internal rotation? Because I see that done normally at other hospitals, and maybe the hospital you're at's like, no, that's not safe, we don't do that. Well, that's interesting because all the other hospitals I go to do that.
That's right.
And so, and hospital providers, when they only practice in their one labor and delivery unit, I feel like they just get that like echo chamber tunnel vision where they don't know that there's any other way.
There's no other way. Well, and I see that too, even within providers in the same practice.
Yeah, I can see that.
They don't ever watch each other support labor.
Yeah.
They never see each other do it unless they're in the OR and they're doing a surgery together or something. But like, I remember talking to Dr. Cap here, who is we love him, right? He's one of the doula loves. Everybody loves this guy. And I remember having conversation about the head of OB at his hospital was a guy who did episiotomies regularly still.
Oh my God.
And he had no idea.
Oh my God.
He had no idea.
Hope he had a conversation after that.
I don't know. I mean, probably not. It was his boss, right? So he eventually became the head of OB himself. But like, those are the things that like, you don't, and I would tell him stories about this guy. I'm like, let me tell you the story. And he would be like, are you kidding me? The guy's so nice. He's such a nice guy. And I'm like,
says nothing about their practices. Yeah.
No.
How nice they are.
Or what happens when you don't go with what he thinks you should be doing? Then he turns into a monster, right? If you are a woman who is trying to make her own decisions, he is abusive and aggressive, and like, he turns into a total jerk. And like, but this obstetrician is like, oh my God, I love him. He's so cool. He's such a great guy. We love hanging out. I'm like, as long as you're not a woman in labor trying to assert her own rights.
Yeah. Or like a home transfer or something like that. Yeah.
Totally. But anyways, I'm sorry I transitioned from that. Let's go back.
Okay. I think we were to talk about VBAC and what is that. So VBAC at a just basic level. So that stands for vaginal birth after cesarean. And it refers to the fact that just because you've had a C-section before does not mean that you need to have another one again. You can actually have a vaginal birth next time, even if you've had multiple prior cesareans. And that is supported by ACOG professional guidelines, the American Congress of Obstetricians and Gynecologists, as well as the complete weight of the current medical evidence. That's the current recommendation that most women with 1 or 2 prior C-sections are candidates for and should be offered a VBAC. Success rates are pretty high, actually, even in restrictive hospital environments. Yet somehow we have like an 85% repeat cesarean rate, and only like 15% of people, a little less than 15% in this country, who have a C-section history are actually having a VBAC. And that's not because VBAC doesn't work or because it's dangerous or unlikely to be successful. It's, I have like an over 90% success rate among my VBAC clients.
Yeah, me too.
It actually almost always works in my experience. It's just because there are a lot of doctors and facilities out there that are either not offering it or not supporting it or not accurately providing information in like a fair and accurate way to patients, maybe counseling people towards repeat C-section, telling people it's too risky, telling people, we don't think you're likely to succeed, so you may as well just schedule a repeat cesarean. And so that's Dawn and I have that same passion. Dawn for much longer than me. But yeah, that's my niche that I do as a doula. I had a C-section with my first, I had a VBAC with my second, and I have a really high percentage of VBAC clients is a doula. I'm probably like 8 or so coming up on my roster now. And that's my passion because, anybody can have birth trauma, but I feel like C-section moms, like even people who don't necessarily realize it consciously, there's just so much the wounds can be so deep from that. The trauma can be so deep, the shattering of your confidence. Like people often don't realize how much trauma is there from needing to be cut open to have your baby, especially, even if it was very necessary, but as well, if there is a feeling that perhaps it could have been avoided with better care, or if it was kind of, you're coerced into it, didn't have a say, didn't have another option. There's just a lot of trauma there for a lot of people. And it is a huge joy and a huge victory for people to be able to overcome that and have a positive experience and deliver their own baby next time.
For sure. I'm a VBAC after 3 C-sections. Thank you. At home. Most people think I'm crazy, but I didn't have any other option. The hospital wasn't going to support me in doing that.
Yeah, and it's very hard, of course. We have historically had some doctors doing VBAC after 3 and even 4 actually cesareans out here, but it is still hard to access. It's very difficult. Even VBAC after 2 cesareans, like I've attended a bunch of those, but if you can't do it on the first VBAC after just 1, the statistics drop down to only 3% of people VBAC after 2 or more cesareans. It's very, very hard to access. And again, not because it's dangerous, right? It's right. Because providers are gatekeeping it and are not making it accessible to people.
Yeah. Well, and a lot of it is like, let's go into why, so here in where I live, one of the biggest issues is that they put a rule that the providers have to stay in the hospital. Yep. If they have a VBAC client who's laboring. Yep. So from a business standpoint, it's a terrible idea for obstetricians to take on clients. Sure. It's a terrible idea because now say you go in to the hospital at 4 a.m., your doctor now has to be in the hospital the whole time while you're laboring. Not all hospitals have this rule, but it's a very common one. Yeah. And then they have to stay the whole time, which now means, say their office hours start at 10 a.m. or 9 a.m. They're missing now all of their patients for the rest of the day and maybe into the next day. If you are continuing to labor for 2 or 3 days, they're stuck in the hospital and they can't leave. So of course, that doesn't make any business sense.
Right.
It's not a smart thing for an obstetrician to do. So I get it.
Yeah, there's a lot of pressure.
Yeah, there's systematic pressure is unreal. But what I don't appreciate is the fact that instead of saying, I don't do it, I can't do it for this, and this reason, they say it's not safe.
Yeah. Yeah, absolutely. Even here, so like I mentioned, generally where I am in Western Wisconsin, and which is near the border of Minnesota. And in general, I think that we have issues in our area for sure, VBAC and otherwise. But in general, I actually love doula work here because we do have some fantastic birth options. But it's really, economically, it's really rough. I mean, even where I am, we have a Mayo down the road from us, and they actually shut down labor and delivery in 2023. That's part of our issues here. But before that, they had a VBAC ban. And there's another Mayo just 30 minutes away in Eau Claire that does VBAC routinely. It's not my favorite place for VBAC, but they do offer it. And instead of telling people, well, you can go VBAC at the Mayo in Eau Claire is where we offer it. We don't offer it at this facility, but you can set up and VBAC there. They would like literally, I just had an attendee about 2 months ago at my cesarean and VBAC support group say, yeah, I was told that it's not recommended. My doctor said I don't recommend it because of the risk of uterine rupture. There's an affiliated facility 30 minutes away, another Mayo that does this. She wasn't told that, right? It's wild. It's terrible. And here, our issues are, again, I kind of mentioned, we are in a rural area. We're really ground zero of the rural maternal health crisis. Since I have moved to this area about 4.5 years ago, we have had 7 either health systems, hospitals, or just hospital labor and delivery units that have shut down completely. 7. Like we are bleeding services in this area. It's a real issue. And many of those hospitals that were shutting down, not all, but many did have VBAC bans because the economic cost of having 24/7, not even 24/7, just paying to have anesthesia in-house anytime a VBAC came in was just prohibitive for them. Anesthesiologists didn't want to do it. The cost was too much, right? And instead, like you said, it's framed as, well, it's not safe. Well, that's not really the issue. It's a staffing issue. It's that they're saying we don't have the resources to offer this, right? Like it's so messy. And so people are having unnecessary C-sections because of just lack of staffing, lack of resources, economic pressure.
Yeah.
It's unbelievable.
Yeah. Yeah. I think that people really don't understand the systematic issues and how someone who might be working in those systematic issues. I've come a long way, Diana. I mean, where I was with doctors at a point, like I was really angry and pretty hateful actually. But I've come to recognize that, like what we were just talking about, is they're just living in this chamber.
Yeah.
And they don't even know what they don't know. They don't, right? Like and I imagine that if we got into the psychology of all of this, first of all, they've all experienced a tremendous amount of trauma of their own. Yeah. That's the first thing. But second thing is that they are in this exact same system that keeps telling them all these things. And I think that there's a certain element of justification that has to happen in order to survive.
Yeah.
Mentally and emotionally, to survive it even.
Yeah.
Yeah.
They're in a tough position, and yeah, it's just, you're right. Like I wish we have so many issues, but VBAC is a perfect one to give example of that. Like in our system, in our maternity care system, a lot of medical recommendations are not actually about safety and what is recommended and what the medical evidence says. It's about other constraints on medical care. Just managing administrative burden, that sort of thing. We could talk about it forever.
Right. Because it's deep and it's the thing that, like, I'm so passionate about helping people understand, because I think so frequently people would make very different decisions if they had all of the information. And it's why I say a lot of what doulas do is really 80% educational and informational.
Yeah.
Versus the 10 to 20% of, the physical rubbing your back, right? It's far more about this stuff.
Yeah, absolutely.
And, I was the VBAC queen. I was called the VBAC queen in my community.
I remember that.
Yeah. Because I did so many VBACs, it would just became like, you know how it is, Diana, once you start there and then all of a sudden you become that name. And then now, the majority of your clients are VBACs, which was amazing. And I had similar experiences with like a huge success rate of vaginal deliveries?
It's all the provider, right? Like if you can get people to the right, I mean, and also to be fair, right? Like not every single person is going to have a VBAC. Of course, it's never going to be 100%. I've definitely had clients who've done all the right things, who've been with amazing providers, and there was still some issue that, you know, we were not able to overcome. And that is true. But like really, you know, when doctors are out there saying, well, you know, your VBAC calculator score is only 52%. And so like you can try, but you're probably not going to be successful. We really just recommend that we schedule a C-section, right? Like you take that person and put them in another practice that does VBAC all the time and is really committed and super comfortable with it and is going to give you every option, every opportunity to achieve that goal, right? You can still have a C-section if something is wrong, but like, you know, they're really going to be in your corner. You know, that's where you can get those 87 to 90 plus.
Right. Well, and let's talk about the difference between VBAC tolerant and VBAC supportive.
Yeah, for sure.
Because a lot of people will be listening to this and they go, oh, my doctor is totally supportive of VBAC. I've talked to them about it and they're totally on board. Let's talk about that.
Yeah. So I just had a client sign on a while ago. She's amazing. And she was with a very conservative facility in our area. I have attended VBACs, including after multiple cesareans with them before, but they are quite conservative. And she said, well, you know, my doctor says I can try for a VBAC, but she wants me to schedule a repeat cesarean just in case. She
Already red flag number one.
And she also wants me to get an epidural just in case.
Red flag number two.
Yeah. And she let me know that my VBAC calculator score is low. I can try. She'll let me try, but I've been told I'm not likely to be successful.
Yeah.
Yeah. So, you know, that would be a good example. You know, practices that like, you know, you can VBAC if you go into labor before 40 weeks.
Yeah.
But we're not going to let you go
It's
past.
the arbitrary stuff that makes them VBAC tolerant, not VBAC supportive.
Yeah. You can, you know, or like, I would say practices where, you know, so to me, right, like if someone says, oh my God, my provider's, you know, so VBAC supportive, like, you know, or another doula says, I attended a great VBAC with such and such. Like, I want to know what were the details, like what was that person's medical history and what was that VBAC like? Because it is easy to support those kind of easy cases where someone has just like a history of a breech first baby, like a scheduled cesarean for placenta previa. Like,
Right.
you know, they're low BMI, their baby's not looking too big. They push for like 30 minutes. Okay. Like, fine. Anybody can support that kind of VBAC. That's easy. Like that's the floor to me. That's like threading the needle. Right. I want to know, how does a provider support more complex cases? How does a provider support somebody who did have a large baby the first time, who did have a failure to progress, you know, who, you know, may have other kind of more complex factors, a history of hypertension. Maybe they do have gestational diabetes. You know, maybe they are pregnant in a larger body, that kind of thing. That to me is where the supportive providers distinguish themselves. I really want to see how providers treat folks with those kinds of histories, because most folks with that kind of background are going to be discouraged heavily. Right. And that's where the supportive providers set themselves apart, right? Is, you know, how are they going to speak to you about the fact that you've had a larger baby, or this baby might be looking large this time? You know, are they going to use that to tell you, well, we may as well pull the plug and just schedule a repeat C-section? Right. What if you need an induction, right? Like, is doulas, right? Like, especially post-arrive, induction is like a whole other conversation. Sure. But like, I also have a big pet peeve about providers that are like, well, we will not induce a VBAC. You have to be spontaneous labor. Because that means a lot of people are going to be sent to the OR unnecessarily. In fact, I'm thinking of a client at this conservative facility I was talking about several years ago, and she was one where I told her she was trying to have a VBAC after 2 Cs, you know, that this is a really conservative facility. I actually don't know if they've ever done a VBAC after 2 cesareans. Like, I don't know if you want to be the testing ground for that. Like, and if for want of traveling 15 or 20 minutes, to, you know, switching practices to just another facility, you could have a much different experience with providers that do VBAC after multiple cesareans all the time and are very comfortable and supportive. And she really wanted to stay in her own community. She really liked her own doctor, and she wanted to do this in the facility her older children had been born at. And so, you know, she decided to stay. And I supported her in that. And this was a really conservative doctor that was like, well, we can try VBAC after 2 cesareans, but I won't induce you. We won't induce. We won't do that. Well, she became hypertensive. What are you going to do? Just send her to the OR, right? And so we talked to her about like the ACOG guidelines that say like, hey, induction's still an option. You can just use a Foley bulb. Doesn't have to be Cytotec, right?
Right.
And she had an incredible VBAC. It was so easy. It was so straightforward. It was like 10 hours, completely unmedicated. I mean, they were like acting like they had never seen it before. And I believe they'd never seen it before, right? And it was incredible, but I mean, they were definitely just going to section her, and she had a completely fine VBAC with an induction. It was completely fine.
Well, Diana, I mean, I think you just like indicated in the most beautiful way, the value of a doula is that she would have never known probably how to get the information about induction of labor.
Yeah.
And how to manage it, and like how to then approach her physician and talk to their doctor about it. And I think that's one of the things that's so important about people understanding about what doulas do. We get in trouble a lot for people saying, "Oh, you're giving medical advice," and it's like, no, giving information is not giving medical advice. And there is it's a fine line, but the reality is I want to provide people with information. And I mean, evidence-based information. I'm not just pulling it off some freaking hokey pokey, website, right? Like I'm bringing evidence in, and then I'm presenting it to you and helping you understand how to discern what it all means, and then encourage you to then have a conversation with your provider.
Right. Absolutely.
And like, I think that's
what to do or not do. We give them information. We can say like, this is how we see it do at these facilities, some other facilities.
Right.
These are options. Maybe ask your doctor about X. If you choose this route, here's some pros and cons to think about. If you choose this route, here's some pros and cons. I see X, Y, Z sometimes. I see these other things sometimes. Just to give people a framework to think about, right? Yeah, we don't give medical advice, but we do give people information.
See, I think this is the misnomer. I think a lot of people just think doulas are there to like rub your back.
Yeah.
I know that's simplifying it, but I think that's what a lot of people see it as. Yeah. Like, I don't want somebody touching my feet. I don't want somebody touching my body, or whatever. There's people who feel that way and they go, I'm not hiring a doula.
Yeah.
When in reality, it's like, oh gosh, it's so much more.
Yeah. It's more about like the advocacy and the patient, the system navigation.
Really. Yes. System navigation.
Yeah. It's really that, I think. I mean, yes, at the end of the day, I always tell people that my goal, right? Like I can do all that. I can do all the fancy positions. Of course, like I bring essential oils, smell lovely, right? Like I can do all that stuff. I can say all the great, reassuring things. Like I can help pull you through, whatever kind of birth you want to have, cesarean, unmedicated, epidural, whatever. But like really at the end of the day, I feel like the goal should be that we put in the work up front, right? Yes. We make the choices, we educate ourselves, we ask the questions. And I'm also very big on body work, right? Because I work with a lot of VBACers who have a history of really more challenging labors where maybe they do have some body balancing issues or like some dietary or lifestyle issues we need to address. My goal is always that we put it in the bank, we put the work in the bank up front, including maybe we switch providers. Maybe we really change our posture. We do some PT, like we may have to alter the way we eat a bit. We do the work, and then hopefully we show up and the birth is just plain vanilla.
Right. And boring.
Any fancy tricks. We don't have to do any crazy advocacy. I don't have to go around telling people I'm a lawyer. Like that's not
totally
good, right? Like I'm very comfortable talking to providers anytime I need to. I'm very comfortable using my voice, and I'm, like it's that good balance where I find they take me seriously and they can see that I can like command the room a little bit the way they can, So we can have a good thing going on there. But like ideally we shouldn't have to do that. We should be able to just show up and have it be smooth and uneventful because we put in the work up front.
That's right. I love that.
That's my style as a doula, and you're right. I wish people knew that more.
Yeah.
Yeah.
I love that if someone is listening who maybe had a C-section or 2 or 4, they got some really good takeaways on like, if I want a VBAC, what are the steps I need to take, right? Like hire a doula, number 1, look for the red flags of being tolerant versus supportive, be okay with changing providers if you are really truly wanting one. And you know, my last question is like, or not question, but like point is just like do the research too, right? Like if you're not 100% sure on why and risks and benefits, like just do the research, look for the information on the internet. But I will I think it was Krista, right? I'll quote Krista, who was a guest on our podcast a couple episodes ago. If you're looking for guidance and support, that's when the doula comes in. So if you want to be supported on your VBAC, if you want to be guided in the right way, that's how.
Put the computer down.
Put the computer down. Exactly.
Right? Kristen said that she said it in the coolest way, Diana. She just basically was saying like most people are looking for support, but what they go and get is information.
Yes, 100%. Oh, I could talk about this all day. And that's a whole other thing. I don't know how much time we have left, so I don't want to like go off on a tangent, but like I'm very big in my doula approach to birth preparation is that we need a paradigm shift on birth preparation away from gathering information, right? Knowledge is important, right? Like, especially in our system, it's so easy to kind of get led astray. But it's really more than that too. The support and also the emotional piece of like self-awareness, knowing yourself, knowing your own values, because how can you choose what's right for you? How do you know how to navigate decisions or what kind of provider you want if we don't really know ourselves and what our values are? And I think that gets skipped a lot. And that's a very deep inner inquiry that I don't think is facilitated enough in childbirth education. And I really try to facilitate that for my clients of like, first, what do we need to know about ourselves, and what kind of coping and other skills do we need to develop to navigate, you know, this journey that we're going to be on, aside from just like stages of labor and like feedback and stuff. On interventions, like that's helpful, but that's like square 0.5.
Right.
Yeah.
No, I could not agree with you more. And obviously, the further along you get in this work, the more you recognize the effort that needs to be made, and recognizing that so much of the statistics are just ingrained in the system, and that if you can still participate in the system and birth there, because if that's where you feel safest, right? But you have to be prepared for what that's like to navigate it. And the people in the system aren't going to be the people to help you do that.
Yeah. Yeah. And to the point too about like, don't be afraid to switch providers and like VBAC tolerant versus VBAC supportive. I'll often tell people, like, especially I'm sure you've seen this, people feel a lot of loyalty to their provider. They're afraid they're going to offend their provider if their provider switch. And they're also afraid of the unknown. It's really hard to make a big leap when you're pregnant. Like the familiar, like devil that you know can feel easier a lot of the time. And I try to tell people like, hey, your doctor could be amazing. Like I had a client recently who came to me with a very conservative practice, same thing. And this doctor had helped her overcome infertility, overcome PCOS, like and conceive her baby. So she had a huge amount of respect and attachment to this doctor because she had been through a lot with this doctor. And we just had the conversation that like, hey, this is not a knock on your doctor. It sounds like she's been amazing and supportive in this leg of your journey. She may be incredible with like endo and IVF and the PCOS, but that doesn't mean that she's necessarily the right person for the birth goals that you're experiencing, especially with VBAC. I tell people to think of it like a medical specialty. You can't just go to any doctor. You have to find someone who really kind of is in that niche. A lot of doctors offer it, but they're kind of just dabbling and they're not really comfortable with it. If you find someone who it truly is their bread and butter, you're going to get a whole different level of care. And that doesn't mean the doctor you're switching from is a bad doctor. It just means different doctors kind of specialize in different things. And it just may mean the one you're with right now isn't the best person for the goals that you're expressing.
Well,
Totally.
if it's a toothache, you're not going to go to a foot doctor.
Right. Exactly.
Right?
Yeah.
Like look at it that way. If you're wanting a VBAC, you're not going to go to someone who isn't specializing in VBACs.
Yeah.
Right. Yeah. I mean, I think it's nuanced for sure, because there's lots of them that say, like you said, they say they do it,
Right.
but whether or not they do it often enough. And I mean, I know when I first started doing VBACs, I was fumbling through them, like I didn't know. They're very different. It's a very different experience than going with somebody who's never had a cesarean. It is a completely different animal to support emotionally, especially.
Yep.
And so if you are just kind of a provider that has like dabbled in it,
Mm-hmm.
it's just not the same. And it's just the same as a doula. I would even say if you're looking to have a real successful VBAC, you need to go find a doula that has a lot of experience.
I agree with that. I think not everybody, it's hard because I feel like not everybody has the privilege to be able to look, you know what I mean? I feel like it's only kind of newer. You did it, I'm kind of doing it, but I feel like there's not a ton of doulas who are kind of specialized in VBAC. I hope that will change. But yeah, I completely agree with that, especially on the optimal fetal positioning part.
Yes.
Like, it took me probably 2 years after I took the original spinning babies to really get literate and really like being able to read a labor and like look at what was going on, even right, because you don't always have vaginal exams, so you have to be able to look at the labor and make an educated guess what's happening, where the baby is in the pelvis, right? Like that piece can be really important. And then also having the confidence to speak up to providers. Some doulas are very timid, right? Whether they're experienced or they're newer. And even I, as an attorney, it took me a while to get my feet under me, figuring out like what is the most effective way to like be able to effectively advocate, right? Like I'm still maintaining a good rapport and they want to do what I'm asking for my client, where I kind of view effective advocacy as being able to lead the room, like kind of really lead people towards where you want them to go in a way that is non-threatening. And it took me a while because, as a lawyer, a very male-dominated profession, right? Like I'm a pretty direct communicator. And it took me a while to figure out like how to work that dynamic with providers, whether it's nurses, whether it's like I've even attended some VBACs with even midwives that were like a little too jumpy or coercive for my liking. And I had to be able to like really kind of redirect them in a way that like they wouldn't find offensive, but that was still effective for my client. It's hard and it takes experience as a doula to do that. So I do agree. I really recommend that if possible, some people, they don't have the funds or whatever, and they need to go with a newer doula or whatever. But if it's at all possible for you, I agree. I really recommend that if you're wanting a VBAC, to have a doula that is very experienced with VBAC, specifically with optimal fetal positioning, and that is confident if you're going to be in the hospital interacting with providers in a way that is respectful, but still assertive, and is comfortable leading the room.
Yeah. And what you'll find is those of us that are that way are type A personalities. So look for your type A personality, because that's going to be the one. The ones who are a little more like dreamy and floaty and like, they're probably not going to be the one to be able to accomplish that.
Oh yeah, it's the whole thing. I mean, I've learned so much being a doula in the doula community that, again, like I do miss the law sometimes, but like there's so much room for growth and for like there's all different types out here and we all have a lot to share with each other and to learn. And it's nuts. I love this conversation. Me
too. I love it too. And I'll be doing it until I die, but just in different ways. But anyways, I think, Diana, we could talk all day long, and I really think that we should come back and dive deep into Kimberly's case and like that whole, like, everybody says when someone posts about a traumatic experience that they should sue a doctor. And I want to help people understand just how challenging that actually is.
That is. I mean, and before I kind of fully transitioned into doula work, and I was still doing like legal consulting and like some of those inquiries I said I was getting that were like been super traumatizing. Like I would tell people like, I'm not trying to sway you one way or another, just like as I do as a doula. I try to be very neutral and just present information, but I would say like, you really have to know like what you're up against, that this can be extremely re-traumatizing for you.
Yes.
Like it may not be like, some people may feel that it's not worth it and that their money, time, energy would be more like better invested in healing, because
Yes.
like the experience, I know we could have a whole other episode,
Right.
is can absolutely be so traumatic and is so difficult, and people will tell you it's your fault, and they will drag you through
Yep.
the mud, and they will slam doors in your face, and they will tell you it was justified and all the things, and it ends up not being the picture of justice a lot of the time. And I hate to paint such a negative picture, because I did that work because I think it's important, and like someone has to do it, or these things will never be challenged, right? Like the law is there, right? But it is not just like, oh, the law is there, so we win. Like there's so much more to it. Of course,
No, so much
it can
more.
be completely re-traumatizing for the family, for the person who lived through
Well,
it.
let's schedule that one, because I'd love to just have a conversation, because I think it's so important for people to understand. So let's get that one on the books, because I think it's an important one. But so we usually end our things with a question. Nicole, go ahead.
Yeah. So speaking of the village, obviously we know that doulas are important and a crucial role. But what other role would you say is one that a woman should definitely look into?
Okay. Yeah. So I thought about this. I actually have two. I don't know if that's allowed, but I'll say.
Loud.
Okay. So I touched a little earlier on how I think that childbirth education is too focused on just information and classes. I also view childbirth like preparation as also body work, like really understanding the state of your unique body and the balance of your pelvis and your sort of pelvic ligaments and tissue, because your baby is born through your body, not your mind, right? So we need to know. I really think chiropractors and pelvic floor PTs in particular are vastly underutilized for birth preparation. And a lot of what we're talking about here with like, do you have a supportive provider and so forth, could be completely moot if your body is so ready and so balanced for birth that you just walk in and have a straight 5-hour labor because everything is like in perfect condition, right? So I always encourage people, don't just like read books and take classes, really go out and get the body work proactively. Don't wait until it's like, oh, I have a breech baby, or my baby's always posterior, or something hurts. Do it preventively. It shouldn't be a reactive tool. It should be done to shape and protect a normal, healthy birth experience from the get-go. And then the other one similar to that, I would say, is nutrition and eat. I think we all know that like a good prenatal diet is important for the health of the pregnancy and for the growth of the baby. But I'm also really becoming nerdy about and like believing that your like metabolic health influences labor function. I really think so. And so like understanding if you're deficient in certain minerals, understanding if you have blood sugar issues, even people who are not diagnosed as a gestational diabetic, like can have real blood sugar issues. And that's how sometimes we can get babies that are a bit on the bigger side, which like, let me be clear, I had clients birth like 11 pound babies. And that's always incredible, but not every person can manage that. And we know big babies are like profiled for C-sections. And anytime there's a labor progress issue and someone thinks you have a big baby, like it's going to be an issue. And so I have had a lot of clients, especially VBAC clients, have really good success improving outcomes, growing a smaller baby, and having way easier labors by basically eating a GD diet, even if they're not a gestational diabetic. And when I say that, I mean like veggies first, protein second, starches or carbs or sweets last, and never eat carbs or starches or sweets naked without other like protein or veggies, basically like just really hacking blood sugar as much as possible. And I think a great resource for that is Lily Nichols, her book, Real Food for Pregnancy, Real Food for Gestational Diabetes, and or getting like a dietitian that focuses on that kind of thing. That has been like outcome changing for a lot of clients of mine. I think it's an incredible tool.
We should have her on the show, Nicole.
I think you totally should. I think she's incredible.
Yeah, that would be amazing. We were talking about nutrition as such an important factor.
Yeah. I think we have to shift it a bit, because I think we know nutrition's important for like health, like health of the pregnancy, but I also really want to shift that discussion into it affects your labor. It affects your outcome as well. You know, if I think it affects like metabolically how functional labor is, how functional your contractions is. That's my personal view based on like what I've been learning. And also like labor is just easier if you have a smaller baby. Like I love a good like big baby success story, but like you can also kind of potentially make it easier on yourself if we can kind of hack our blood sugar responses and just keep the baby's growth a little bit more tamped down. And if I'm not being clear, I should probably just add for any like viewers that don't have this background that excess maternal blood sugar can drive fetal growth and make baby a little bit bigger. And so making sure we're not flooding our system with a lot of like sugary beverages and like sweets and carbs and like, you know, don't get me wrong, I love carbs and pregnancy is a time that people should not be restricting. I'm not talking about restricting. I'm talking more about like making sure that you eat your veggies first because it like reduces how much sugar is absorbed into your bloodstream. Eat your protein second because then your intestines, like the lining is so coated that if you eat any starches or carbs last, less gets into the bloodstream.
Yeah, more or less than like how than what.
Exactly. Yeah, exactly. It's not about diet during pregnancy. It's not about restricting what you eat. It's like the order you eat your food can actually affect how much blood sugar you have in your bloodstream and how big your baby gets, which is like fascinating to me. And that is one of the little tricks that I employed when I was preparing for my VBAC. I was very, very careful the order I ate my food in. And my VBAC baby was a bit smaller, even though he was born kind of like 5 days later than my C-section baby. It's fascinating, really.
The more you know, right?
Yeah, for sure. Well, Diana, thank you so much for coming on with us. I hope that the folks listening are just as engaged in this process as we were. I think that was a really great discussion and I can't wait to talk some more, but I really appreciate you.
Yeah, I appreciate you too.
So if you, for more information about Diana, you'll find anything in the show notes. I'm sure we referenced several things, so we'll make sure that's all in the show notes if you need anything. So thanks for joining us again today. Have a great one. Hey, thanks for joining us on Speaking of the Village. If you love today's episode, make sure to hit subscribe and share it with a friend.
And remember, you're not alone. We're here, we're listening, and we're all in this together because in our village, no mom walks alone.